trying to understand, can we subtly quantify the qualitative research? So subtly, of course, not truly, and take away the gist of qualitative research. So let's see how it progresses, and then we can take it from there. So
Yeah, sure. And I think keep sharing your experiences also, because it's a mutual learning. So probably we'll
sure,
also.
sure, sure. I agree with you. I totally agree with you.
Thank you, Dr. Abhijit.
Thank you. Thank you.
So now coming to the various, in this session, we'll discuss the various qualitative approaches. So in the first session, now you are clear like what this qualitative research is all about. And coming to the approaches, like many of you must have heard regarding this grounded theory, phenomenology, ethnography and all. And we'll see like how one approach is different from the other and how to differentiate. Because once you see these initially, you might think that, phenomenology is very much similar to grounded, and then narrative, how it is different from probably the case study or something like that, or maybe phenomenology, how it is different from the ethnography. So there are various types. We'll see how to differentiate between these study designs or the qualitative approaches, and what approach you should take depending on your research question or the central phenomena. So approach is, there is a relationship between the data and analysis, and the type of research question you choose or type of analysis you choose, your approach, qualitative approach basically is guided by that particular thing. So first thing is like linear sequential. You can see that what is linear sequential? Linear sequential is when you collect the data and you analyze it. You don't go back and forth. You have got all the transcript, you start analyzing it, you make codes and categories, and then you have come up with a theme. So that's the linear sequential. The second way is the iterative. What is iterative? You start collecting the data, means the transcript, and you simultaneously you start analyzing also. And then you collect more data, and then again you analyze it. And in that also, if you come to know about some other uh, key informant where you have to take the interview, you take the data from that person also. So iterative is going back and forth, like taking the interview, making transcript, analyzing, then again going and collecting the data. So this is iterative. So the first way is basically linear sequential. Basically, there are two types of analysis, or the qualitative approach is there. First is your content analysis. So if already there is a published content, like you see that many people, they do the qualitative analysis on the whatever is there in the Facebook chats, or even if it is there on Twitter. So whatever people are writing over Twitter, especially you will see that the political analysis, that is a lot of analysis is being done, the content analysis on the published content of social media and the other sites. And then if you generate theme out of that, it is known as the thematic analysis. So this type of approach is known as the linear sequential. The second is the iterative. So it is the classical, if you see the grounded theory and phenomenology, if it is an inductive in nature, like we have seen in the grounded, we will see in the grounded theory, inductive, you know what is inductive. So you don't know anything from the beginning, and you generally derive the theory or the theme from the data. It is known as the inductive. And if you are only observing and writing, it is known as the ethnography. So there are various researches, qualitative approach. We are only discussing the most commonly used ones. Like there are other methods like participatory research, all those we are not discussing. So here we are discussing basically the grounded theory approach, the phenomenology, ethnography, narrative research, the qualitative descriptive studies, which are the recent one, and then the case study. So basically, we'll be discussing these 6 type of qualitative research approach, and depending on the particular type of central theme or the central phenomena or the research question, you will adopt a particular research approach. So the first is, here we will understand all these approaches using this research question. Like the question is the exploring the barriers to effective patient communication among healthcare worker in managing chronic disease. So with this example, we have tried explaining all type of research question. Coming to the research approaches. So first is the grounded theory approach. So for grounded theory approach, first I would like you people to see this movie clip.
Here we go in 5, 4, 3, 2.
Here in Salamanca, Spain, President Ashton has been working with leaders from 5 continents to forge a new groundbreaking alliance.
Today, we make history.
The President of the United States has been shot.
We need your camera.
You saw the shooter.
There was something in that window.
I saw something too.
We have to respond.
You can't give the order. You've been shot. We risk telling the world that you weren't really there.
We weren't there.
We need you to tell us what's going on.
I think I just told the guy who did it. We're shut in the city now.
The NSA has just confirmed the threat.
Do we know who's behind this?
Don't release him. He knows something.
For the moment, the Americans think they've dodged a bullet.
Secret Service, we need to see your tapes.
I'm in pursuit, heading west.
We have a satellite lock. We're looking for 5 people out of 6 million.
Surprised to see me alive?
Stop. Rewind that.
Oh my God.
What did he see?
What have you done? What have you done?
The beauty of American arrogance is that they cannot imagine a world where they're not a step ahead.
There's something else going on here. Control is compromised. Get off! My partner is in pursuit of a suspect.
Get out of the way!
This can't be happening.
There's no 20 on the president.
Where is he?
Go! Go!
So yes, this was the movie clip of a movie which is the Vantage Point. So what do you mean by vantage? Yes, anyone? So basically, we tried seeing in the dictionary what is the meaning, and vantage is like at different angles. So here you can see that there were 8 people, and there were single incidents. It is a mystery. I think. Have anyone seen this? Okay, Dr. Abhijit has seen this. Dr. Assassination attempt on voters. So yes, I did not watch it, but I have just read the summary for showing this in this qualitative research, because it has got, if you see like any murder movie, it is not only this, any murder mystery or any mystery movie, how they start with the search. Yes, you all must have seen any murder movie or any mystery movie. You can all please type in the chat box, or read any novel. These days, although the reading novel, maybe some e-book, novels or some stories. Yes, you can write the name here. Dr. Abhijit has seen this, but anybody else who has seen any other, not only this. This was just for one example. Yes, so Drishyam. Dr. Abdul, Sherlock Holmes, Dr. Jalinder is writing. Anybody else? Any story or any movie or any novel? So how generally they start with any good murder mystery or movie or any detective story? How they start? So basically they start from scratch, and they initially they have suspicion on some. Okay, so Ria is writing all Agatha Christie novel. Yes, Ria. So they have suspicion on some one person, and then they start taking the data, collecting the evidence, taking the data, and then their suspicion, it keeps on shifting from one person to the other person. And then when they try to link all the loops, and when try to make a thematic map, like how the events got ended and what was the chain of events, and then basically they come to know regarding who is the actual culprit. So that's how if you like relate those murder mystery novel or any like movie with the grounded theory, you will come to know regarding how this is usually solved. So basically in grounded theory, what we do, you go and you start collecting the data and then you start analyzing also. So you have got some initial codes and you have got some initial category. Then again, you go back to the field and collect the data. So like I said, iterative, it's the back and forth process, and your categories, and we will learn more about this in what type of codes you form. Then you start linking those codes. So initially you have got open code, and then you make axial code, means you start linking those codes together, and then finally you come with the selective code, which is the prominent one. So similar in the grounded theory approach, what we do, when should we do a grounded theory approach? So whenever I wish to derive a new theory of a research, or if already there is a theory and I can find some gap in that and I want to fill that gap, then I can adopt a grounded theory approach. So if I am collecting the data, doing the analysis and doing the theory generation, is it a grounded theory approach? Or if not, then what is the type of approach? In this case, if I'm doing a qualitative data analysis, I'm doing a data collection, data analysis, and I've generated a theme. Yes, then what type of qualitative approach I am going? Am I doing the in this case, I'll give you the example, but in this case, since we have done this initially also, so this is a linear sequential, like in the first slide we have seen. So in this case, we'll come ethic. Okay, ethic can also be there. It can be a quantitative also, or in qualitative also, it can be simple, like we do for a linear sequential type of design, like we have done it initially when we do the content analysis. Yes, you are right. So it is not a grounded theory approach, rather we follow a iterative approach. So how iterative approach is there? We start with the data collection and we go and do the data analysis. Then again, we go to the theory, we generate some theory. We again go for the data collection. We again have some change in that theory. And then again, we go for the data collection. And then again, we come with the final theory. So this process goes on till you are satisfied with what the theoretical generation you have done with your data. So with the example, yes, we have shared many articles with you people. I think I will show a few here also. So in grounded theory, generally theories are derived from the real world data, and the data collection and analysis, they occur iteratively. So just to reiterate, when should we use the grounded theory approach? So when there is no existing theory to explain the phenomena, or if there is an existing theory, but the data used to derive that theory is not complete. So there are two fundamental concepts to that grounded theory. So data collection and analysis are cyclical, and you start with the raw data and you don't have any deductive framework. You start inductively. So with each cycle of coding and analysis, you move a step closer to the theory development. So like this example I was telling you people regarding the water, when you ask regarding the type of research, so this you can see there's a water table. So if you dig from a superficial area, so you get a water which is a less purified one, and that water will only be there for years or days. If you go deeper again, then again you have got a more pure water, and that will be there for centuries. But if you again dig deeper and deeper, the water which is here, which is in millennia, that will be there for millennium, like forever. So this, if you apply this concept to the grounded theory or data analysis, so if you are just seeing the transcript superficially and analyzing, we will see the type of approach, it will be more of a descriptive in nature. But if you dig deeper and deeper, then it will be more interpretive, and that theory will be last forever. Like health belief model, there are many theories which are existing. Like there is a critical race theory, or there is a critical theory, which is a theory for oppressed people. So that theory got made by digging the data very deeper and deeper. So already there is a theory which is existing. So such type is like more deep into the psychological domain, and it is more interpretive in nature. So how do you know that you are doing a grounded theory? So yes, whenever your aim is to develop a theory, if your goal is to develop a theory or an explanatory framework that can explain, in this case, that how this communication barrier is existing and what processes are involved. So in grounded theory, we are more into the processes which are there. And like I said, iterative data collection. So we are iteratively collecting the data and analyzing it, that back and forth cycle. So as we have developed a new insight, we again go back and collect more data. And there is something known as the purposive sampling. We will discuss that in more of a sampling section. But there's a purposive sampling, like you try to have more diverse nature of sample in your data so that you can have more refined, you can have more diverse nature, and the saturation should not be achieved very early. So this is regarding the iterative data collection. Then coming to the focus, there should be a focus on processes, because we know that in grounded theory, related to communication, if I'm talking, then I should be, if I'm doing a grounded theory, I'll be focusing more on what are the processes which is leading to this communication barrier. Is it the like processes, maybe processes in the infrastructure, processes in the human behavior, processes in this communication chain, when there is a receiver, there is a sender, and there is a medium in between. So how these communication barrier it is emerging. So if I'm focused on more on these processes and action, then I'm on into the grounded theory. And out of those seeing those processes and analyzing it, I am generating a new insight that is explaining a broader process. So this can be done by the grounded theory. And like I said, the type of coding methods used in all type of research will be a little different. There is some common coding methods, but for grounded theory, we will discuss that there is a separate type of coding method, which is known as the open coding, which we do first. Then there is a axial coding, and then there is a selective coding. So don't feel like, don't think that these terms are new. Once we head with all these presentations and discussions, and you will also do the hands-on practice, these terms will be very familiar to all of you. So like this is one article which we have shared with you people. The understanding the impact of COVID-19 pandemic on health-related quality of life among Iranian patients with beta thalassemia major, a grounded theory. So again, the today's exercise will be, we will share 6 articles with you people. And they have defined a name, approach for that particular article. You have to critically evaluate that article and what you have read today. You have to match whether the approach the author has used, is it a justifiable approach, or you have, if you want to comment on any of the methodology or approaches the author has used, you can comment. So you have to critically analyze those 6 articles, and each article is based on each approach, like one on grounded theory, one on ethnography, one on phenomenology, the qualitative descriptive, and the mixed method, narrative, and case study. So this is one article. Again, this is another article which is a grounded theory of type 2 diabetes prevention and risk perception. So this was done on Asians who are living in the London. And if you go through this article, they have also perceived like, people living in London also, they don't want to get themselves treated, means they are more into eating the sweet thing, and they are saying what to do, like what will we do, how will we live if we don't eat sweet. So they are not perceiving the risk of diabetes as the disease is. So if you go through this article, you will find very interesting, it is a very interesting read. So these are 2 examples of this grounded theory. So again, to summarize, this grounded theory is basically, it is inductive in nature. You start from the data collection, and then you do some coding and theory generation. Again, you go back in the field. again do the coding, and again refine your theory, and it's back and forth. And there are many like until you are satisfied with what you are getting, and then you stop collecting more of data. So this is regarding the grounded theory. Coming to phenomenology, so this phenomenology is basically the as the term is saying, phenomenology, it's the study of some phenomena. So now how to define a phenomena? So phenomena is basically, it is a lived experience. So the catchword here is the lived experience, and the another catchword, if I say, that is the personal meaning. So if you catch these two, so it is the lived experience of any phenomena. That phenomena can be a event, or we'll see what can be the phenomena. So if the individual are perceiving it and they are attaching a personal meaning or a personal significance for them, that can be defined as a phenomena. So if my focus is to understand the essence of those lived experiences or event, like what it feels like, how people interpret it, how they describe it. So basically, understanding the personal meaning of any phenomena is known as the phenomenology. And if you are interested in knowing the personal view of any phenomena, then your research design will be phenomenology. Like how to, in this case, how to identify if your central research question is exploring a phenomena. So if it experiences on if it focuses on a personal experience, like in your case, this communication barrier, you can describe it as a phenomenology because you are saying that this is on a personal experience, how people are experiencing or how healthcare is experiencing this doctor-patient communication. So instead of what happened, you might ask here how people felt. So here you can see, Dr. Abhijit, the importance of the what and how. So if you are interested in phenomena, then more questions should be like how. It should not be what, because again, what will be like knowing the descriptive nature. So how they have felt, how they have perceived, how they made sense of a particular event or a particular experience. So phenomenology is more focused on the how. So how do patients experience communication barrier with the healthcare provider? And then if it is subjective, in case of a phenomena, you will see that it is more of a subjective in nature because it is individual perspective. It is individual personal meaning to that particular phenomena. So if my research question seeks the multiple reality from different people of a phenomena, I will definitely go for this phenomenology. Like what it is like for caregiver to manage the loved one's chronic illness. It is again a subjective in nature. So my research approach will be of a phenomenology. If I want to understand the meaning and perception, then again, phenomenology is the right way, right research approach. So if phenomena is something what people think and interpret their own way. So like if I can ask this question, how do people make sense of their experience with long-term care during a chronic illness? So this is again the same, uh, because we have labeled that research, that document which you have received, that proposal, that is a phenomenology. So the question which I am asking, that how do people make sense of their experience with long-term care during a chronic illness? Again, these questions these are difficult to answer. So if you need to answer these questions, again, I said that the person needs to think before answering these questions. And if now let's see the difference between these two type of questions. So the first question is like what? So if I ask this question, what are the challenges faced by the patient with diabetes? So this will be a factual information. Again, the question is for what? But again, if I ask this question, how do patients with diabetes experience living with their condition? So here I am asking because the person must be suffering from diabetes. So in the first case, it might be some other person also who have seen people suffering from diabetes. So if I ask this question, how do patients experience living with their condition? So here I am asking because one person in the first example, it can be somebody else whose father is a diabetic or whose mother is a diabetic. And then you can ask this question like, what are the challenges? But in case of a phenomenology, it should be the person who has suffered that event. So you can see here, like cancer survivor or caregiver. Yes, Dr. Anandita is right. And then this the next one, it is a subjective experience. The second one, like how do patients of diabetes experience living with their condition? So again, coming to, I think Dr. Abhijit has asked one question. Okay, what is grounded and what is phenomenon? Okay. You are explaining that what is grounded and okay, understood. So yes, then again, identifying, if you are identifying some factual thing, like what communication barriers exist, then it is a factual one. And if you want to have a subjective experience, means your research question is asking for a subjective experience, then it is the phenomenology. So seeking factual information by individual is non-phenomenological, and exploring the subjective experience of individual regarding any phenomena is a phenomenological. So like you people said right now, the cancer survivor. So again, this, you can see this video and you can comment whether it is a phenomenology or not.
When I first found out that I had to get my leg amputated, I was just like, I was in complete shock. I mentally had to prepare myself to come to terms that I wouldn't have a leg anymore.
I feel like every single aspect has changed. I don't think one thing hasn't changed. I went from being an independent 14-year-old and to having to ask my mom just to get me a glass of water.
That was actually really one of the hardest things about this year, was I lost school, and then with that I lost a lot of friends.
My life ended up now being in a hospital bed.
Definitely one of the hardest.
Oh, sorry.
Parts of something like this happening is you have no control.
So the first chance I got to get a wheelchair where I could push myself, I took the opportunity, and now I'm much happier where I am because I'm much more independent and not relying on everyone else.
Well, what's been different is now I can't walk. I have to walk on crutches, a walker, be in a wheelchair.
There's a point in time where I didn't want the door shut. When I had to be by myself, it was really, really terrifying at first. And I start crying and stuff because I felt like I was alone in a box. I'd feel shut out from the world completely.
The whole year I just didn't feel like myself. Everything just changed.
Chemotherapy started, and that really just hits your body pretty hard. I lost 25 pounds.
You do get dizzy and you do get nauseous and you just want to go on your left side and you're just like, okay.
Alright, sweetie. Here we go, okay?
And you have that bucket next to you where you're about to vomit and it's just like, yeah.
The nausea, I can't explain it. It just feels nasty inside my body. Every time I want to throw up, but I can't eat because I...
So can you see that, what type of approach, if you have to explore the experiences of maybe the survived sarcoma patients, so you can treat it as a phenomenology. Yes. How do you feel? So it is the subjective experience basically of a phenomena. So for that you need to define a phenomena. So researcher described the meaning of lived experience of a phenomena. I think there were many researchers which came after tsunami, because the people who survived the tsunami, if you are trying to explore their subjectivity regarding what happened and how it has affected their mental health and their overall health, then this will be like a phenomenology. So the research question, again, it will be essence of a phenomena of interest and how they feel, And then data collection method can be interview, it can be FGD, it can be observation or documents, and analysis will be a phenomenological analysis. Like there can be other research question, what do cancer patients cope in terminal diagnosis? What it is like to survive a plane crash? What are the experiences of a long-term care of family members? And what it is like to be trapped in a natural disaster. So here it is like, it is the main research question is starting from what, but don't think that it is like what, because it is a main RQ and then you will be in the sub questions, you will have more questions regarding how they have felt. So this is one example, like a phenomenological study on the experiences of patient transfer from intensive care unit to general ward. So generally you will see that patient feel very happy, especially during the COVID time. You must have experienced with many of your near and dear ones, like initially they were in ICU and then when the oxygen saturation it increased, then they were shifted to the general ward. So this was one study which was done by there is a researcher which is the Lee, and we have shared these articles with you people. This was a phenomenological study. Again, this is the lived experience of patients with COVID-19 infection. Again, a phenomenological study. So now, many times you will, if you get confused between this phenomenology and grounded theory, so we have tried to differentiate, compare and contrast between these two approaches. So basically, a grounded theory, like I said, this the main crux lies between in how the research question is framed. So if the research question is more inclined towards the processes means like what are the barriers, how it, like in this case, if like with this example we can see, if I have to ask a question in phenomenology, the nature of questions will be the open-ended and experience oriented, whereas in grounded theory, like I said, it will be process oriented and it will be action oriented and it will be understanding like why and how things are happening. And in grounded theory again, regarding the nature of the interview also, the person whom you are interviewing, in case of a phenomenology, that person should have suffered from that phenomena. But in grounded theory, it may not be necessary. A person who is a key informant or who has seen people suffering or observing the people, they can also be as a key informant interview in your case. So in this case, in phenomenology, basically the focus is on you, like how do you feel when communicating with healthcare provider? Or can you describe a time when you felt misunderstood by a doctor? Here the patient is like telling the barrier or what it is like for you to experience. So in this case, you are seeing that we have made this you in red. That means it is basically the you, means we are focusing on that individual, on that subject, that how, what he has experienced and narrating it. So that is phenomenology. Whereas if you see the grounded theory, here generally, basically we ask regarding the processes, like how do communication barrier develop? What factors contribute to the misunderstanding during medical consultation? So here we are not describing like you. Like I will also give you one example of vasectomy. We did one research on like uptake of vasectomy. Here it is very low, and why, like male clients who are coming to the OPD, what is their take or their perception regarding the vasectomy? So there we have selected all the eligible men who were in the reproductive age and who were married. It was not necessary that the person should have undergone the vasectomy. So if I take vasectomy as a process and then I interview all the men who have undergone vasectomy, then it would be a phenomenological analysis. But if I am talking to any person and I want to know their perception regarding vasectomy, who may not have undergone vasectomy, and then try to know the processes, because definitely if you are interviewing someone else, he will tell you more about the processes, then it will be a grounded theory. Okay, so that's the difference between the grounded theory and the this phenomenology. Now coming to the third type is ethnography. Ethnography, it is less done in India because you will not get permission generally, because ethnography, you will say that by ethnography you are generally, you will what we have experienced that it is not easy to do, and it is intensive, more intensive than the grounded and the phenomenology. So intensive, how come? Because here the researcher has to be in a role. In an active versus passive role, it depends whether the ethnography is active or passive. So the researcher observes the traits and behavior of participants in real time. So you go and you watch, maybe as a part of that team or maybe as an outsider. It depends on the type of ethnography. So in generally ethnographic research, the researcher, they frequently, they live with people and they become a part of their culture or organization. And then the researcher explore he can interview also in between. The interview can be a formal interview or it can be an informal one also. And depending on that, he can come up with a co-created story. So now read these two situations and think what the researcher is doing. Yes, can someone read these situations? Yes, any volunteer?
Yes, ma'am.
Thank you, Priyanka.
You want to observe the interaction between terminally ill patients and healthcare workers in an ICU setting. For this, you decided to visit ICU for 1 month as an observer. Now, you want to observe the interaction among patients attending the OPD. For this, you decided to visit the OPD daily for 1 month.
Okay, so now you have seen these two situations. So now you have to answer next three questions. So the first question is how these two research situations are different in terms of study setting. Like you have to answer open versus closed. So which is the open one and which is the closed one? Yes, all of you please type in the chat box. Can I see the chat? ICU is closed. Yes, OPD is open. Yes, right. How these two research situations are different in terms of taking consent. Like whenever you take consent, that is overt and then other is covert. So which one will be a overt and which will be a covert? OPD open. Yeah, that's right. OPD is overt. And overt, like what do you understand? If you are taking consent, then it will be a overt or a covert. So covert is hidden. So in ICU, you cannot be covert because it is a closed system. In OPD, it will be covert. Are you getting my point? OPD is like, yeah, ICU will be overt because, okay, got it. How come? Because in closed system, the patients are there for longer period of time in ICU. Generally, they are there for 10 days, for 15 days. Like their stay is longer. Whereas in OPD, they come for a very short period of time, maybe for 1 hour, 2 hour, and there is a high inflow and outflow, and the system is open. So there you don't need to go and take consent of anyone. You have to take consent, but that is from the administration side. But since you are not interviewing anyone, in case of a covert, you are just sitting and you are observing. So it is a covert in case of a OPD. Whereas in ICU, if you are constantly there in a closed system, you have to live there as in for a long time is same for both, but for an extended period. And also, since there will be interaction between you and the other staff and the other patients and their relatives probably. So it will be overt. You need to take consent from the patient relative apart from taking the permission and the ethical approval also. So that is the, like overt versus covert. And then coming to the third type, which is the active versus passive observation. So in case of a ICU, it is an active observation. because then you will be asking informal discussion you will have with the nurses, with the relatives, and with maybe some, if the patient can speak or cannot speak, depending on that, you can talk, depending on the day of observation. If the patient is able to talk towards the later end, then you can also have a conversation with the patient. So active versus in case of a OPD, you are not going to ask from anyone. It is just the passive observation. So these are the three types of ethnography. It can be an open setting, depending on the setting. It can be a open versus closed. It can be a overt versus covert, or it can be a active versus passive. These are some examples, like hand hygiene behavior, where you can do ethnography just as a covert. You can just see them doing this behavior. Attitude towards biomedical waste disposal. This also, it can be a type of ethnography. Hospital staff behavior, attendance outside OT. So these are some questions which you can see. So for ethnography, you need to mention all these three which we have seen. And then you have to, like, in case if you want to study this high volume patients to understand hospital culture, then if you have to frame a question, so again, you know that in this case, you will only be observing the patient. You will not be taking interview in case of a high volume hospital. So the research question for such a type of ethnography will be on the, if you are doing an ethnography for long term, like for ICU, then you want to study the culture of ICU. You want to study the culture of the particular organization if you are there. Or generally it started with like observing tribes, their cultures. So why they are doing some practice. Generally anthropologists, they do more of these ethnography. So then you can do that, and data collection can be done using the participant observation, because participant observation is a type of method of data collection in case of a ethnography. And then you can do the focus group discussion also, depending on active type of ethnography. And data analysis is again constant comparative, where you come up with the themes. So like in this case, communication barriers, if I have to do a ethnography, so my research question will be how to do a healthcare provider and how do the healthcare provider and patient navigate communication barrier. If my research question is this, then I will spend time in the hospital. I will observe real life patient interactions. I'll take field notes, and I'll have some informal conversations also with the healthcare provider. This is one article which we have shared. The title is The Dance Continues, Evaluating Differences in the Call Bell Use Between Patients in Private Room and Patients in Double Room. So using ethnography. So there the nurses, like the person like stayed for a month, and he was just observing what is the frequency of call bell, like how the call bell pattern. The person who is in private room, is he ringing more bells, or whenever he is calling the nurse, for what purpose he is calling. So if you go, this is also a very interesting read. The difference between the call bell use between the patient and patients in the private room and patients in the double room. Again, this is one ethnography, developing patient-centered care, ethnographic study of patient perception and influence on the quality improvement. So now there is something known as the critical ethnography. What is a critical ethnography? Basically, when the ethnographer stays for the long period of time, and then his behavior also gets changed, and he starts thinking in that particular, for those particular people. That is known as the critical ethnography. So yes, I'm just showing you a movie clip. You can see this, and those of you who have watched this, you can comment this. Let's see what this clip is all about.
मैं ऐसे लोकतंत्र में विश्वास नहीं करता जो गरीबों की इज्जत करना नहीं जानता।
हमारा मूवमेंट जनता के लिए और ओखर अधिकारों की रक्षा के लिए हमन आखिरी दम तक लड़बो। लाल सलाम।
तुम्हें मिले थे ना गोवर्धन पहाड़ उठाने वाले, और तो कोई सुरमा है नहीं पुलिस डिपार्टमेंट में।
मैं मानता हूं कि गलती हुई है हमसे। सरकार ने भी ध्यान नहीं दिया आप पर और आपके साथ अन्याय भी हुआ।
लाल सलाम।
60 सालों ले ये लोग धोखा देते, मीठी बातें सुना के झूठे वादे करत है, थोड़ी मिठाई खिला के आपका खून चूसते है।
सरकार चाहती है, देश चाहता है कि आप उसके विकास से जुड़े।
अरे मत भूलना कॉमरेड, ये लुटेरी सरकार की पुलिस।
जो भी बंदूक की नोक पर सत्ता हासिल करेगा, वो फिर राज कैसी ताकत से करेगा, ये आपको सोचना चाहिए।
ये सारा नाटक हमारी जमीन छीन के हमको बेदखल करने के लिए।
लाश लटका दूंगा उस साले की।
तुझे राजन चाहिए ना, मैं दूंगा तुझे राजन।
पुलिस लॉकअप से भागकर सीधा जंगल में घुस जाना। रात को पुलिस वाले जंगल में तेरा पीछा नहीं करेंगे।
नाम क्या है?
कबीर।
पूरा बता, कबीर का।
पुलिस वाले हो क्या?
पुलिस वाला तो तय है, हमें मालूम है कि तय एसपी आदिल खान के आदमी है।
हमें भी मालूम है कि तू माधुरी दीक्षित है।
कीमत की परवाह मत कीजिए।
ये लिस्ट है 230 आदिवासी गांवों की जो हमारे प्रोजेक्ट और माइनिंग एरियाज पर बसे हुए हैं। इनको भी खाली करवा दे।
आपके डंडे के बगैर ये गांव वाले कहाँ हटने वाले हैं?
हमारे डंडे कानून और व्यवस्था के लिए, और जिस दिन उसकी जरूरत पड़ेगी अच्छे से इस्तेमाल करेंगे हम।
सब मुनाफा देखते हैं। सरकार, पुलिस उन बड़े लोगों के लिए है, आम आदमी के लिए कुछ भी नहीं। इसीलिए तो हम लड़ रहे हैं और पूरी ताकत से लड़ेंगे।
कबीर मत करिए, इसका अंत बहुत भयानक होगा।
सही बोल रहा है तू। अगली बार जब हम मिलेंगे, हम दोनों में से एक ही वापस लौटेगा।
So yes, this movie clip is from a movie which is the Chakravyuh. So has anyone seen this movie, Chakravyuh? Okay, so if you have not seen, here what happens that the inspector he sent the Abhay Deol to those tribal areas just as an informer. So he went there and he started observing people and started seeing their plight. So then he got transformed, and then later he again turned into a rebellion. So initially he has gone as a friend, but when he saw the plight of those tribal people, and when he saw that whose reality is real, so then he has started acting as a critical. Maybe we cannot call it as a ethnography here. Why? Because he has not gone for research purpose. He has gone just to take the information from those people. But yes, his behavior got. So similar thing happens with the ethnographer. Many times he goes there for a research purpose, but when he spends a lot of time, then he becomes a critical ethnographer, and because he wants to do some change, because that haunts him, that these are the problems and he wants some solution of those problems, so he becomes a critical ethnographer. So I think there are few articles when you see that I was going through one article, maybe I'll show you during the later part of this presentation. In the Africa, they critical ethnographic study between the nurses, midwife and the females, because females, they were getting a lot of negative behavior from the midwives. So while doing those critical ethnography, the researcher, he started campaigning and started for a respectable delivery through the nurse midwives. So this is known as the critical ethnography. So we discussed up till this time point the grounded theory, the phenomenology, and then ethnography. The fourth type is the narrative research. So narrative research is basically when the person, like Dr. Abhijit was saying, that one person point of view can be entirely different from the rest of the one. So that one person, if you want to express his view completely, making a story, so then you can do a narrative research. So in this case, okay, Dr. Latika is writing, Avatar movie is also good example of critical ethnography. Yes, true. Although I have not seen this, maybe I'll go and watch. But I have heard that yes, there also he acts like a like maybe transforming those particular people. So I'll go and watch, Latika. Thank you. So now coming to narrative research, here the researcher describes the stories. The people tell about their lives and their experiences. So this researcher and here it is the narrative of only one or two person, not more. So you cannot take like many people and make a narrative because it's the story. So story cannot be made by many people. So one, maximum two people. So it is generally, it can be a biographical narrative, it can be autobiographical, it can be a personal history, or it can be a oral history. So in case like this question could be as a narrative, like what it is like to climb a mountain with an elevation over 20,000 feet. So the research question could be the story of a lived experience of one or two person and people who contribute to the story of experience. And then again, how it is different from phenomenology, because phenomenology also you ask from the subjective experience of people, but there the central phenomena is about the one phenomena, the central theme. Here in case of a narrative, it is the story. So the person and the researcher, they both co-create a story, and then they use the narrative analysis as a way of data analysis method. So whenever you are doing the narrative research, you should know that there should be very strong relationship between the researcher and the participant. And then researcher has to play a very active role because he needs to be, co-constructing the stories. And interview is the most common method of data collection for such narrative research. So this is one article which we have shared with you people. Stories about bodies, a narrative study on self-understanding on and chronic pain. So this again, this was done on nurses, and they have come up with a very nice explanation how they feel about themselves and the pain which they feel. So this is the excerpt, but I'm just skipping this. Again, this is a narrative analysis done by the complexity of choice after prior cesarean section. This is again abstract. I'm skipping this. Again, this is one narrative like you are not alone, sharing of anonymous narratives to destigmatize mental illness in medical students and faculty. This was again one study which was a narrative study. Now coming to qualitative descriptive study. So we have discussed up till now grounded theory, phenomenology, we have discussed the ethnography, and we have discussed the narrative. Coming to the qualitative descriptive study, so these qualitative descriptive is a recently developed type of study, and here how it is different from the other type. Here, as the term suggests, descriptive. So you don't dig deeper. Remember that well example. So when you remain shallow, you don't derive a interpretive meaning. You don't dig deeper. It is like you are doing a qualitative descriptive. So it is a simplest and very easygoing qualitative research. And like if you are a first time researcher, I would always advise you to go for this qualitative descriptive. Once you do this qualitative descriptive 3-4 studies, then you should go with any other type, maybe phenomenology or narrative, because generally it is difficult for you to start directly with the grounded theory, because you need to understand those concepts. So once you do 3-4 qualitative descriptive, then you should go ahead with the type like phenomenology or maybe the grounded theory. So here you only need to describe the phenomena of interest, and you do the purposive sampling, and you only ascribe the meaning, you don't do much of the interpretive analysis. So you don't move far from the data while analyzing, and it is less interpretive, and that's the essence of a qualitative descriptive study. So it is a separate category And again, you don't need to render very highly abstract concept. So like these are few example of qualitative descriptive like strategies and challenges in Kerala response to the initial phase of COVID-19 pandemic. So in health research, you will see like health system research. These days, you will see a lot of qualitative research going into like RNTCP and in the HIV. HIV, though it was there since beginning, since it is a stigma, and like other programs like maternal and child health care, the vaccination program. So regarding like what we also did one qualitative descriptive for RSV, uptake of RSV vaccine, vaccine hesitancy during the COVID. So those phenomena, like if you are just seeing it from a health system perspective and you are only, you don't try to dig and delve more depth into the meaning, what the people are saying, and only describing, then it is more of a qualitative descriptive. Again, like self fetal well-being monitoring and antenatal care during the COVID-19 pandemic. This is again a qualitative descriptive study from pregnant women in Indonesia. Again, this is one example like women's view and experiences of maternity care during COVID-19 in Ireland. Again, it is a qualitative descriptive study. So you see in most of these study, there's a title and then they classify what type of study it is. And many times you will see that they catch some phrase from the excerpt and they make it as a title. Now the next is your mixed method approach.
Can I ask a question?
Yeah, sure.
Yeah, this is related to narrative research. I find it very interesting because here it's about building a story with respect to the response from one or maximum two people.
Yeah.
So, under such circumstances, how much time does it take to undertake a narrative research?
Okay. So it time depends on the like type of narrative you want to have. If you like I said it can be a autobiography, it can be a life history. So if it can be if it is a life history or autobiography sort of research, then it you need an extended time period. But if it is like transition, like I said, like transition from no, ICU to you know, ward, maybe if you are taking one person narrative, or cancer survive, or maybe as a if you're taking one person narrative story of a surviving after maybe plane crash, so then it is a short that description will
Right.
not last for more prolonged time, so then duration will be very short. So it depends on the type of narrative you want to say.
Right. Okay. Thank you.
And coming to this mixed method again, Dr. Abhijit, you were talking about this mixed method. I'll just come to your point, which you were telling during the break regarding you started with qualitative and then you
Right.
went to quantitative.
Right.
So
Right.
this type of research method is known as the mixed method research. So there are three, basically, classically, we define these mixed method. You know, can you recall that in mixed method, what type of research paradigm we have? We have a pragmatist research paradigm.
Yes.
If you are
Pragmatist.
going quantitative, then we have called the positivist research paradigm. If you are going for all those like grounded theory, phenomenology, ethnography, qualitative descriptive, narrative, then it is a type of which type of paradigm it is? It is constructivist because you are seeing it as a multiple reality. But when you think that, you know, both you can fit yourself into both type of research and the only purpose for you is to solve problem because you think that reality is changing. It is constantly changing. So in that context, you adopt to this mixed method and then you go both for the quantitative and qualitative type of research design. So when you do both type of qualitative and quantitative simultaneously and you compare them or you relate them, it is known as the convergent parallel design. Then another type is when you start with quantitative and you want to explain something. Like I gave you the example of iron folic tablet intake. So in Bihar, it is very low. Like if you take the indicator in NFHS, it is only 12% of women who took the iron folic acid tablet in their pregnancy for more than 100 days. If I want to explore the reason, because I know that there is availability, I have this data that availability is there. and they are going for antenatal checkup, then what are the reasons for the low uptake? Then I might go for a explanatory sequential, because I want to have explanation of a particular quantitative finding, and that's why I am going for this, to have a more nuanced insight into my data. Now, next is your exploratory sequential. So, what Dr. Abhijit was talking, that was exploratory sequential. So, there I start with the qualitative data collection, and then I build on the quantitative data collection on that. And generally, it is done for a newer topic, where I don't have a tool. And generally, you will see that in case of a tool development. So, we had a workshop recently with a tool for a tool development, and there are many people who are doing a thesis or a PhD thesis on a tool development. So there probably their design will be your exploratory sequential, because they first develop the tool. So for developing the tool, they have to start with the qualitative data collection.
Right, right.
Develop the tool, and then they take the data on that tool, and then they do the
Perfect.
quantitative
This is
analysis.
exactly what we did. We did qualitative research to get the variables for developing the fully structured quantitative tool, actually. So,
Yes. So you did a mixed method where you started with the qualitative, and then you ended your this research as a quantitative one. So typically, scale development or any tool development for a reflective construct, generally it is a type of a exploratory sequential design, and it is a type of mixed method study. So this is again, there are few examples like No One Says No to Money, which is a mixed method approach for evaluating conditional cash transfer scheme to improve girl children status in Haryana. Again, this is a mixed method study of public perception of social distancing, which is integrating qualitative and the computational analysis of the text data. Again, mixed method study for parental perception of physical activity and quality of life of children under home lockdown in the COVID-19 pandemic. So now coming to another one type of research, I think this is the last one, which is the case study. So case study, as you see, generally in clinical side, case study is termed as a, when you describe a case fully, starting from patient history, investigation, their treatment, and then what was the salient finding with their surgery, or maybe the other features, then that is known as the case study. So now what is a case study in case of a qualitative? So basically in qualitative case, don't get confused by this term case as a patient. So here the case is defined as any bounded system. An institute can be a case. India as a country can be the case. Bihar as a state can be the case. So it can happen to a person also, and it can happen to a group of people or a single unit also. But again, then you will ask, like, how, if you are doing a study single person, then how this narrative will be different from case study? So generally we have seen case study being done on a bounded system, very less uh, happening on a person. So narrative research is when one or more individual who want to share their life story is the narrative. And we did a one case study also regarding that RSV. Probably we'll discuss that when I'll be discussing the analysis part, the deductive part. So narrative research, we know when the one or more individual want to share their life history, that is the narrative. Phenomenology, several individuals who have shared the same experience, the subjective well-being or the subjective feeling. Grounded theory, whenever you are emphasizing on that process or action or interaction that involve many individual. Ethnography, again, it can be the as a active or passive, open or a closed, like we did. And case studies, any program or any bounded system, which is closed system, and you are assessing the activities or assessing the components of that, it is known as the case study. So if you are a qualitative method, like this is just the summarization, you will got a paradigm. If you are a mixed method researcher, then you will say that research question drives everything. Then you are a pragmatic. And if you are a quantitative, like believe on the this post positivism, then you will go for a quantitative research. Now, few lines on sample size consideration. So this sample size is basically, there is no such said rule about the sample size. But generally you need to commit some sample size because you have to get a ethical clearance, you have to get a institutional review clearance also. So there is a heading of like sample size, and many times most of the discussion goes into that sample size. How come such, like I was discussing in the beginning, such small sample you cannot take for a qualitative research? But again, there is a you have to convince them that there is no such sample size criteria is not there, like with the 80% power and 5% of this precision and all those things you cannot calculate here in case of a qualitative research, because here even the perspective of 1 or 2% is important, as it is a perspective, and we say that there are multiple realities and reality is not single. So that's why there's no predetermined sample size. Generally what happens that there is a term known as the saturation, and this happens when you do the data collection, and that's why we say that you should do the analysis also simultaneously, because when you do the analysis you will see, you will do the coding and you will make the category. Then after some time you will see that your categories are not changing and coding are not changing. Whatever data you are getting, that is falling into the existing code. So if you are not getting any new codes in consecutive three transcript, you label that you have reached to the data saturation, and then you can stop collecting the data. So this saturation is reached early when you have got the homogeneous sample. If you have got the heterogeneous sample, that's why you should have a purposive sampling. You should try taking viewpoint of the various diverse type of people. Otherwise your saturation will be reached very early. So that's why we say that the sampling which you do, that should be a purposive sampling, and generally researchers should decide whom he wants to take as a study sampling, and maximum variation or diverse sampling should be done to get more views, because it's the multiple perspective. So if you take same kind of people, you will not have those multiple perspective or multiple reality. So to come up with a multiple reality, you need to take those many people. And theoretical sampling is, what do we understand by theoretical sampling? So you do a small, you recruit a few people, and you ask from them, and then you take another person whom you think that you should take. So it is the identification of a new sample from the existing interview. And this process continues till you reach the saturation. That is known as the theoretical sampling. So the data collection methods, there are many data collection methods which we will discuss tomorrow. So there is one-to-one interview, there is a focus group discussion. So I think we'll discuss these things tomorrow. Coming to the ethical consideration. So yes, qualitative research is all about ethics, because here you cannot cross check it. Somebody else cannot cross check it, because it's your perception and your viewpoint with which you are analyzing the data. So there are few ethical considerations which we know, like you should take informed consent from all the person, and it should be written informed consent. You can do the audio taped consent also. And if the person is less than 18 years, you should take assent also. And while doing the interview, you should keep these 2 points, which is the beneficence and non-maleficence, into your head. Like you don't have to do any harm to the person. So you should be very cautious while you ask any question or pose any question. And then you have to respect the patient autonomy. If the patient doesn't want to respond to a particular question, or if he says that I don't want my this thing to get recorded, then you should respect his or her autonomy. And there are power differences. This we'll discuss more in the interview process. Like interview should not be at a place where there are power difference. Like if I'm being called at the director office for the interview, definitely my director is asking something from me regarding the institute. I cannot say negative things regarding that. So the interviewer and the interviewee, there should not be power difference between those two people. Otherwise, the genuine response will not become. will not come. And then again, very important point is the confidentiality. So you should not take that. We'll discuss more in the data collection, that you should keep those things the data in a very confidential manner without taking any identifier. So these are some of the ethical consideration. So when you have started thinking about the research, you should take the ethical and administrative and local approval also. Whenever we want to do something with the state of Bihar, we take the Bihar government approval for conducting any qualitative or a quantitative study. And that again, like I said about the site, it should not be at a site which raises the power issue. Especially we are from the community medicine, and people who are working in the community, there if there is a various people of various religion is there, and if you select a mandir or a masjid or any religious place, then the people from the other religion, they might feel reluctant to go to that place. So it should be a neutral place, and it should not be like something which creates some misconception in the community regarding the processes by which you are taking the interview. Then if you start the taking the interview, you should refrain yourself from doing any pressure on the participant for signing the consent. And anytime they can refuse to be a part of the study. And for the data collection and data safety, generally it is said that you should store your data in the transcript for 5 years. And while in analyzing or data also, you should report multiple perspectives. You should avoid citing any participant and disclose only positive result. Like Dr. Abhijit was also sharing his experience, that they were asking regarding the what majority of the people they were saying. They were not into the notion like what one person is saying. But for qualitative, even if the one person is different from the other, his perspective is also equally important. And again, while reporting, you should not falsify the evidence. You should report honestly. And in publication, generally with one ethical clearance, you should not try doing multiple publication. Uh, so you should not do that's known as the piecemeal publication. So you should not be doing those things, and you should always be what should I leave? Okay, no, triangulation I'm not discussing. This is the last slide. And you should provide a copy of the report to the participant. Generally in Bihar, even if we ask them, generally they don't have an email, or it depends on the literacy status of the person and the involvement in the research, but it is said that it is ethical. And in the interview, we'll see there is something known as the member checking. So we'll discuss those points, but you should share a copy of the report to the stakeholders and the participants who are there in your research. So
Can I add one more point here? You've talked about participant debriefing as well in your document, which you said, shared a couple of days back, actually. So before you finalize, after the interview, you're supposed to do a participant debrief so that he or she acknowledges whatever he or she has shared, and then you move.
Yeah, truly said. So you can go through the slides, and I think we'll share the recording. You can go through it, and we are again, but tomorrow we are meeting at 9:30, because tomorrow is a half day for us, and the institute gets closed at 1. So tomorrow session will be from 9:30, and we'll try to it may stretch up till 1:30, because there are 4 topics, and you have to conduct interview also tomorrow. You have to develop interview guide also tomorrow. So there are 2 hands-on exercises. So that might take some time. So get prepared, like you can have some food or something in between to just refresh yourself. And so tomorrow we are meeting at 9:30. Shall we call a day off for today? Conclude the session? Okay. So thank you. Again, so today is what is the end of the day assignment for today? So we have shared articles with you people, the 6 types of article, and you have to critically analyze. We have shared the template also, under which heading you have to analyze those articles. And then you have to come up whether the approach the researcher has written Are you convinced with that research approach or not? Okay. Okay. So thank you so much.